Made possible through support from Developmental Pathways and the Arc of Aurora. A Think Change training.
Hello everyone, and thank you so much for tuning in with us again for episode 4, talking all about CBD and people with developmental disabilities. I am Erica Dennison here, joined by a doctor in pharmacy today, so we can learn all about Epidiolex, because that is something that a lot of people probably do not know about. So before we dive in, I do want to just give the gentle reminder that we are not here today to give you any type of medical or legal advice. We're really here to offer you some foundational knowledge, and so if you do have specific medical or legal needs, please consult with your own medical or legal advisors. So here today, I'm super excited. I'm joined by our special guest, Dr. Laura Borgelt, who I would love for you to introduce yourself to our viewers and our listeners, and just let them know a little bit more about who you are, what you do, and your background.
Sure. So as you've mentioned, I'm Laura Borgelt. I'm at the Anschutz Medical Campus at the University of Colorado. I've been a professor here now for over 20 years.
Wow.
And really loving it and enjoying it. I actually got into this particular space with cannabis in my clinical work, where I worked in a family medicine clinic to help doctors be better prescribers. That's kind of my role in the clinic. And one day we had a medical resident, come into our learning area and told us about a patient who was breastfeeding and smoking a joint per day. And what was a little bit surprising about that whole conversation, besides that, at that time, was that the resident told the patient that was completely fine. And I said to myself, I'm pretty sure that's wrong, but I don't know if it's right. And I didn't know the answer to this question about the impact of cannabis, particularly in women who are pregnant and breastfeeding, which is a vulnerable population, of course. And so with that, we did some research for which there was very little at the time. This is going back 10, 12 years ago now. And came back and reported what I could find. I was asked to give a talk at a meeting, and then I was like this expert in cannabis. And it literally within 3 months, I was making this decision about, is this an area that I want to venture into or is it not? And at the time, I felt like, as a pharmacist in particular, and recognizing that cannabis is indeed a medicine, we have many forms of prescription-based cannabis, it was almost my responsibility and my obligation to educate in this space and to learn as much as I could about it. And so it has been a journey. It has been an interesting one, and I'm looking forward to this conversation.
Absolutely. And what a long journey, 20 years. I mean, that is impressive.
Thank you.
You deserve a very well-deserved vacation.
Yeah, thank you.
That's amazing. Thank you for sharing with us a little bit about your background, as well as this transformation of kind of entering the cannabis realm. So thank you. Mm-hmm. Awesome. So we've talked a lot about in other episodes when it comes to CBD 101. What are those basics that people need to know when it comes to accessing CBD, as well as, what does it look like if you use CBD in a school setting or in HCBS? But my question for you right now is, what is Epidiolex?
Mm-hmm. So Epidiolex is a brand name for a prescription product for which the generic name is cannabidiol, or CBD. And so this is only available by prescription, which means it has been clinically tested and studied for several different conditions, in particular some rare movement or seizure disorders. So the age is 1 year or older, with patients or people who have Lennox-Gastaut syndrome, Dravet syndrome, or let me make sure I get this right, because I always mispronounce it, tuberous sclerosis complex. And the TBC is what we call it, or TSC. These are all movement disorders in very young children, and they're relatively rare. So those are the 3 indications that have been brought to the FDA and for which Epidiolex has been approved. This is an oral solution, which makes sense for young children.
Sure.
And so it is dosed based on weight and is increased over time based on the response for the seizures. And so there are these primary conditions that now there are other ongoing clinical trials with Epidiolex as well. It's been studied in Parkinson's disease. It's been studied in autism. It's being studied right now in autism, and some of the behaviors that the people of this audience might be interested in. We'll talk about that a little bit later. So it's being studied in these populations. It's not yet approved for that, but the research continues for a lot of those types of conditions. So it's really exciting.
That is very exciting, especially knowing that, I knew that Epidiolex was only really made available to the 3 diagnoses that you had shared, but knowing that it's kind of being explored for maybe someone who has autism or, Parkinson's, that's exciting, knowing that they're kind of expanding their research to see if maybe it can be a helpful medicine for other people. So
yeah, and I think the primary role right now for Epidiolex is really in movement disorders as a whole. So it's been interesting to watch that transform.
And very exciting for you, I'm sure.
Mm-hmm.
Yeah. So when it comes to CBD, right, that we've talked about in other episodes versus Epidiolex, can you share a little bit about what those differences are?
Sure. So as I mentioned, Epidiolex is available by prescription only, and I'll call it artisan CBD maybe, or retail CBD is available everywhere. And I know that you've covered that in other episodes. And so when we look at something that has gone through an FDA-approved process, what that tells us is that there have been rigorous clinical trials done in specific patient populations where it's been tested for safety and efficacy. And so what it also tells us, it gives us some confidence in the quality of that product, that it's consistent, that it's been tested consistently, the labeling will be consistent, the way that it's produced. They're following good manufacturing practices, which gives us some certainty about its quality. It wouldn't have contaminants, doesn't have variety because it is a purified form of CBD. It's not synthetic, it is plant-based, but it is a highly purified form of CBD. When we look at retail or artisan CBD, it really is kind of across the board. And I think one of the most important first differentiators to make is whether or not it's hemp-based CBD or if it's cannabis-based CBD. And so if it's hemp-based, that means it has 0.3% or less of THC. And if it's cannabis-based, it could have a higher amount of THC in it. When we're talking in these conversations, it's primarily about the hemp-based CBD because most parents are looking for the CBD product and not the THC in the product. But I do think it's important to recognize that because of this differentiation and potential existence in the market, that is something to really be looking for. Some of the, I guess if I were to say what are the benefits of having that available in this kind of a space is that there's more dosing freedom. There's a little bit more that people could do, smaller or larger when tested and labeled appropriately, right? The risk that people run is that it could be contaminated. I think that testing will tell us that there have been products that have contained heavy metals, that they have contained other contaminants like pesticides, that there could be mycotoxins, which are bacteria or fungus in the product, and that clearly presents a risk. And so I think with the CBD products, it's one of these where it just becomes extremely, that risk-benefit ratio changes.
Sure.
And we don't have consistency across the retail CBD product lines.
Yeah. So really, the biggest difference is that Epidiolex has this consistency and it's FDA approved, and for general artisan CBD, there's a lot of kind of unknown mixed bagged with it, right?
Correct.
Got it.
Yep.
Yeah, that can be very confusing for folks. I appreciate you breaking that down for us.
Yes.
Could you share a little bit about why someone may choose to use Epidiolex as an alternative to CBD? We know that there's only really those 3 diagnoses that you shared earlier that really can access it right now, but why would someone maybe explore Epidiolex versus just the artisan CBD?
Well, I think there's an interesting space that we call off-label use, and I think that's a question we get quite frequently, actually, about what is the potential for off-label use, regardless of condition. And I think there are many medications that we use off-label, meaning it's not the FDA-approved indication on the label. But I think with Epidiolex, it becomes very tricky, particularly because of the way that it's formulated. And the dosing, ultimately, at the end of the day, tends to be much higher because of the way and the way it's produced and the conditions it's treating with the approved indications. I think people are wanting that quality standard product, but it's hard to find physicians who are able to, for a lot of reasons, prescribe it in a way that is off-label, and that makes it challenging for access.
Absolutely, it really does. Do you, if someone with a disability or developmental disability, or they had a loved one who has a developmental disability who wanted to start exploring Epidiolex, where would you suggest that they start?
Well, I think firstly, I really have a very strong belief in the patient-provider relationship, and so I think if they feel comfortable enough with their providers to bring it up, express their concerns about what are the issues that they may be trying to resolve, what are the conditions that are at play. As I mentioned earlier, these clinical trials happening particularly with autism or behavioral issues associated with autism are being investigated, and this can include things like aggressive behaviors and if I think about movement disorders, sometimes the way that they lash out, or a lot of the high energy, high frequency, high anxiety positions where CBD is known to have some sedative properties. It can make you feel a little bit more calm, and so some of these properties are really wanting to be explored. But I think starting with the physician first, understanding what that particular scenario is, and the other medications that they're using, because we have to put that into the whole mix, to help them make a good decision about if CBD is the right option for them, and then if it could be an option, how do you get the CBD from the prescription, or how do you get it from the retail provider?
Yeah, absolutely. Do you feel like if someone has a doctor that may not really want to explore the CBD discussion, what advice do you have?
Well, I think this is a really interesting conversation. This is a little bit aside, but we did a survey of bud tenders to look at what the type of information that they give patients in pregnant and breastfeeding women based on this initial story I told you.
Yeah.
And it turned out that many bud tenders were providing inappropriate information. And I think it becomes a concern when the bud tender, who may or may not be well trained, especially in Colorado because of the regulations here, in giving, like you mentioned earlier, medical advice or legal advice. In some states across the country, the pharmacist is the only person that can dispense any sort of CBD product or any cannabis-based product. And that presents a little bit of a different scenario for access and informed communication about benefit risk and those types of things. So I think I would have to say that doesn't answer your question perfectly. Some of it is based on self-research. Some of it might be talking to another doctor who is a person who can recommend cannabis. And that's often where I tend to go as a plan B. If a provider that I'm working with is not willing to have that conversation, I'm not willing to accept that, quite honestly. And so I've made many recommendations for physicians who are writing recommendations for cannabis and have them do the proper evaluation on a patient to see if they are, a good candidate for a CBD product or a cannabis product as a whole. And then, of course, you have the internet and all that. But
the internet. It's a beautiful thing.
Right.
But also be very dangerous.
Correct. And that's why I think going to a trained medical provider is a much better, safer place to be.
That's great. I really appreciate you sharing that information, just because I think this is the reality of life, that, everyone has their own opinions about different things when it comes to CBD. And so knowing that you certainly have alternatives to exploring some other medical professional is certainly something that someone can do. Yeah. Kind of wrapping up this conversation, do you have anything else that you want to add for the people who are tuning in, whether that's via our vodcast or tuning in via our podcast?
I do think, my lens has always kind of been through the lens of patient safety first. And so when I think about this population and those that might be interested in learning about this, I think taking a look at patient safety is really important. And so there's a few things that I'd just like to mention as here's buyer beware tips if they are going to go into the retail CBD or artisan CBD place. So I think, first of all, starting with testing of that product. Most products should have a certificate of analysis. And in that certificate of analysis, they talk about the content, the contaminants, these things that I mentioned earlier with pesticides and heavy metals, just to see the quality of that product. Then I think you're looking at the label. And many of the labels now will contain a QR code, and the QR code will identify where the cannabis came from, who the manufacturer is, what the detail of the seed to sale kind of concept. Some products have that, and other products don't, and that can be another indicator of how much information you will have access to about that product. And sometimes that QR code contains the certificate of analysis as well. So that's very helpful. When we look at the product labeling, you want to make sure there's no false claims about therapeutic efficacy. That's a big no-no to the FDA, but I think it's also really important that buyers understand that this is not a prescription medicine. In that particular product would not be therapeutic efficacy trials to support it, so they really want to watch the marketing of those types of products. And then I think once that product is home, being really thoughtful about where is it being stored, how is it being handled, and I think when we think about storage, it is locked in a cabinet or in a safe place where animals, children, others, it's a medicine, so it needs to be treated as such, and the storage can be a helpful part of that as well. So I think the patient safety for me comes first, and then hopefully people can find products that are of good quality and will work well for their needs.
I love that. And I love that you said, treat it as a medicine, because I think so oftentimes people don't view it as a medicine. They just kind of think it's like kind of something more bougie, if you will. You know what I mean?
Yeah.
And so treating it with respect, treating it as a medicine, storing it safely and appropriately, I think is a really, really great tips for people. So anything else to add before we wrap up?
I feel like we've covered quite a bit.
I
Happy to join you again sometime in the future if you need more, but I love it. It's great. It's really fun.
Awesome. Well, I really appreciate your valuable time, especially knowing that you are a doctor of pharmacy and that you are an expert in this area. So I certainly appreciate it. And I know our viewers and listeners do too. So thank you again for joining us for this multi-part series all about CBD and people with developmental disabilities. And we'll see you soon. Take care.